you. Inhale. Now feel the energy spreading in all directions, healing those who need. Second time when we chant, put your mind in the hospital environment, all the beds of this Longmont Hospital, wherever there is a patient, mentally visualize and let us send a powerful healing vibration to every patient in the Longmont Hospital. Inhale.
Eyes on Longmont, offering a diversity of topics about our community that will inform and entertain you. We invite you to sit back and enjoy this edition of Eyes on Longmont.
My name is Michelle Bowman. I've been a registered nurse at the Longmont United Hospital for over 30 years. And ironically, I was one of the first babies born there. My family homesteaded in Niwot. So my roots are really in this community. I really care what happens with the health and the well-being that flows through this community. In 1993, a group of older adults in the role that I was performing in at the hospital at that time, I was asked to be involved in a wellness program for people 55 years of age or better. And this group of what I call the wise ones wanted our hospital to kind of swim upstream a little bit. They wanted us to do things differently. So they did a fundraiser and they sent me to China. And I went with the American Society on Aging to meet with the Chinese Commission on Aging. Again, they just wanted our hospital, Little Longmont United Hospital, to take a different look at how we were delivering care. Since we're a not-for-profit community hospital, and they said, gee, Michelle, we're the community. So I went to China. I studied with a large group of gerontologists. I met with a lot of different individuals in China. Came back rather transformed because there's many things we do not want to emulate that I saw in China, but there was many things that I saw that were wonderful, including exercise every day in the park, people being in community. I came back realizing we needed to start more community types of exercise and projects and just general well-being. So that's how we got started with our integrative medicine program. It was a real community-driven request. How do you truly put the patient and their family at the center of care? Sometimes care in our culture has been based on what the physician orders. And sometimes what the physician orders is really good and really necessary, but it's not what the patient wants. If the patient's not a partner in their care, they're probably not going to be as adapted to the plan of care. They're not going to be a part of the solution. So patient-centered care means bringing that patient into the solution, into their own self-responsibility, and into the essence of healing that's so necessary. And I think that's really what true healthcare reform is going to be about.
I am Dr. Rohini Kanaganti. I'm a board-certified family physician, and I've been practicing medicine for the last 13 years. I was trained in medical school at the University of North Carolina in Chapel Hill. After medical school, I spent a year traveling, and part of that year was an intensive study in Ayurvedic medicine in India, so that I could really hone in on my skills and my wisdom about integrative medicine. There's a boarded specialty in holistic and integrative medicine, so it's very well accepted. That form of integrative medicine recognizes that there are any number of modalities out there that can be evaluated and tested to see if there is a reproducible benefit to human beings. And because they have found a benefit from a variety of different modalities like acupuncture or herbs, body work, massage, yoga, meditation, Ayurvedic medicine, truly a whole range of modalities that exist that have varying levels of evidence and good evidence that they actually benefit people. Traditionally, that's what's understood now as integrative medicine, is the integration of conventional medicine, which is the diagnostics and the evaluations and the treatments using pharmaceuticals, as we've been trained to do, alongside a number of these other modalities.
I think that we are just in the age of technology now where there's just more communication. There's more education and there's more resources. My clients, as in many other healthcare practitioners that are dealing with more holistic therapies, are seekers. They have become more in line with understanding what is happening to their body and taking more personal responsibility to do their own research, to ask good questions of their physicians and medical staff, and to follow up with other practitioners if they're not getting what they need. So in the past 25 years, I have built a community of medical associates that we work together in this integrative program of medicine, which is much more powerful for my clients and their patients, that they now have a team that is dealing with both holistic and allopathic medicines. And instead of taking surgeries and medicines as the first approach, it now becomes, what can I do to feel better, to live better, to have more strength and energy? And they are using many programs that are available in this community, from vitamins and minerals to a nutritionist, to working with physical trainers, and massage, chiropractic, reflexology, energy workers are no longer just pampering of oneself. They have become part of people's lifestyles, part of their care program, part of their wellness program.
Nutrition is the basis of all health. No matter what kind of treatment you're receiving, what your health condition is, any medications that you're on, if you're post-surgery, pre-surgery, your nutrition status is an extremely important part of how you perform in your life. So I would always recommend maintaining the highest nutrition status that you can. Along those lines, I see a lot of patients with a cancer diagnosis who are either pre-treatment or in treatment or post-treatment, trying to reduce their recurrence of cancer. So we're talking a lot about a basic foundation of nutrition, which is what are you bathing your cells in on a daily basis. When you're eating something like beautiful chard and cauliflower and peppers, you are giving all of your 10 trillion cells exactly what they need. If you are eating a diet of processed food, meaning it's devoid of most of its nutrition, it's been added back piece by piece, you are getting a lot of very inflammatory factors, you're not getting near the nutrition that this provides, and you're not doing yourself any kind of service at all. So we are trying to we're trying to coax people to come back to the plant world mostly. I'm not espousing a vegetarian diet or vegan diet or any kind of diet, actually. I just am trying to get people to come back to real whole food. That seems to be a critical part. That's what all the studies show. What I find with people is that there's a lack of exposure. People don't know what chard is. They don't know what to do with chard. They've never had anything like it before. It's an odd food. So, and then it goes on from there. Kale and collards and peas and beans. These are foods a lot of people haven't been exposed to in this generation. So I feel like my role here is to bring people back to whole foods, spices, getting people familiar with using spices in food, simple, economical ways of cooking. It's a really basic process. A lot of people have lost that exposure, basically, and knowledge. A big cause of chronic disease is inflammation. We've been hearing about this now for years and years. Cancer has a basis in inflammation, diabetes has a basis in inflammation, joint pain, autoimmune disease, all the baseline is inflammation. If you're eating whole foods, you're not going to be inflamed for the most part. But if you're eating a diet of processed food, you're likely to be very inflamed, and you're at least going to have a lot of joint pain. And your mind will be fuzzy, your memory will be bad, and you'll just start a whole process that a lot of diseases stem from. I had a woman in her 40s, also pre-diabetic, not really understanding how serious the situation was, and she's like, well, the commercials look like these people are doing fine with their diabetes, and they look happy. And I'm like, the picture of diabetes is something very different from that. It's very dangerous, and it's a killer. It's killing a lot of people. So the reality of that is much worse than what the TV commercials are showing. So she was a little aghast at that. She drank a lot of Coke, a lot of soft drinks during the day, and just a lot of like mac and cheese kind of things, processed food, pizza, the typical American diet. So after a few conversations with her, she really took it on. She really changed her lifestyle. I've seen her several times in the last couple of years, and she is now a total advocate for eating well. And she has dropped all the soda, and she's like a spokesperson for eating well. It's incredible. So another example of using nutrition for health is I had a woman who was having very poor sleep quality, just waking up very frequently in the night. And I found out that her blood sugar was kind of on a roller coaster. She was not eating enough, so that she would wake up in the middle of the night and be wide awake. And we figured out that this turned out to be a blood sugar issue. So we changed how she ate in the evening so that her blood sugar was maintained through the night, and she slept through the night, and it changed her whole life to be able to sleep again. So if you eat sugar at night, you're going to have a crash. Or if you're drinking alcohol at night, you're going to crash like between 1 and 3 a.m. and you're going to wake up, you're going to feel pretty badly as a result of dehydration, but also blood sugar issues. So alcohol is a big factor to deal with a lot of people. There's a lot of people drinking their glass of wine every day who aren't sleeping well and not making that connection. Michael Pollan is a food journalist. He's written several books, and he has a maxim that I like to follow, and I like to tell people. It's really simple, it's easy to remember. He says, eat food, not too much, mostly plants.
We started with 5-element, which is an ancient Taoist acupuncture. Pre-Chairman Mao in China, way old. And this is where we actually look at how nature manifests itself in each of us. And looking at how we are in balance with nature and out of balance with nature. And a big part of that is sitting down with someone and listening to their story, building rapport with them so they trust you enough to share what's going on. And then when you start to hear what's truly going on, you start to see really where they're out of balance. And so acupuncture is a beautiful way to help bring the body back into balance.
And we can measure the electrical conductivity of things. We can measure how the heart works with an EKG, or the brain with an EEG. So we are just a big electrical bag of water. The acupuncture influences that flow electrically. So it actually changes conductivity. It also stimulates the production of body's natural pain relievers. So doing acupuncture, generally you're going to feel much calmer, a little more relaxed. And after the treatment, your pain should literally be less. We use single-use needles, individually sterilized and packaged. They don't have to be really big to actually do what they're supposed to do. Aquí, dolor, pain. Okay? A little tender. Yeah. Tender areas, when you're palpating and looking for these kinds of things, indicate areas of weakness. So they would be points that generally you would do. This area up here is kind of lung and heart is related in Chinese medicine to sleep. So now, the patient can have difficulty sleeping because they're in pain. And then, of course, if they're not sleeping, then the pain gets worse, so it becomes a bit of a kind of a little vicious cycle. So we want to make sure that they're getting as much sleep as possible, so we may adjust some of the herbal medicine that they're taking. But there are a lot of little tricks to help people sleep. The what I keep? Right there, okay. This is a point on the bladder channel, which is related to the pain that he's having. Why does acupuncture work? It stimulates the body's endorphins and enkephalins, our body's natural pain relievers. It also changes kind of the electrical conductivity. It opens the flow, if you will, and thereby helps things. Every body is unique, and that is what makes the practice so much fun and so challenging, is because every single person really is different. What they eat, what they drink, how they rest, how they move. All of these things are playing a role in how quickly something improves. Miguel is taking Western medicine. I mean, he's got hypertensive condition. Now, there are definitely herbal formulas that could help diminish the need, perhaps, for the full amount of dosing that he's doing on the Western side of things. Now, we haven't addressed that issue yet. We may do that after the pain piece has been resolved. But I think he has needed less Western medication for pain because he is taking some herbal medicine in addition to the acupuncture. So, I mean, this is an example of Western and Eastern medicine working together.
I have a long history of eating things that I shouldn't have been eating. I didn't know that I shouldn't have been eating them, but
So what was your level of discomfort then, do you think?
I would say it was probably like a 7.
And what is it now?
And now it's probably like a 2.
Wow, that's really reduced.
Yeah, it's really different. It's very different now.
It made a big difference to you.
I would say that the acupuncture is definitely a huge contributor to the whole scheme of my health improvement. There have been times when after one of these sessions I take a nap, a long nap, or I sleep the next day a lot more than normal. But then after that, it's like, yeah, it's a really good energy booster.
Oh, that's good.
And if you just give it a try, you'll definitely notice a difference. You will definitely notice a difference. We take my dogs to have acupuncture.
Yes, I've heard that it's
And
very good
it
for
is
animals.
amazing.
Yes.
It's amazing. In fact, that was one of the big convincers for me years ago with one of our older dogs. They were having problems, walking. They were like 15 years old. And so we took them to an acupuncturist, and when we got home, one of my dogs was like throwing his toys up in the air. I mean, it was like it was the fountain of youth in a way for him. And I was like, whoa, I'm going to get me some of that.
A lot of our older adults, seeing as how my specialty is working with older adults, are touch deprived. Some of them don't have a partner anymore. They don't have their children living near them. And so they're touch deprived. And touch is an essential, absolute, mandatory part of what we need as human beings because we're a tactile species. We need touch. So what we then started with was we hired massage therapists, and we found out very quickly that our older population loved it. And they started coming in lots of quantity, and we started offering massage in the hospital. So it's that touch. It's touching that person with compassion and care, and also listening to their story. So while you touch them, you also listen to them and hear what they have to say.
Victor, as far as your pain, on a scale of 1 to 10, what was it?
Oh, it's probably about 6 or 7 this week.
Okay. So Victor is 95 years old, and Victor has had several injuries and accidents throughout his life. A couple of years ago, he actually fell and broke his neck, so his second cervical vertebra, and he's had open heart surgery. So some of the muscles that I'm concentrating on Victor are his upper trapezius, which kind of help us in our posture. They're sometimes headache muscles, so have pain referrals into the head, and he suffers from headache muscles. When your shoulders are drawn forward, which his are with his postural component, you know, that puts stress and tension and kind of shortens the muscles. So we just try to elongate them, decrease some of the tension. One other thing that's really important after we do massage is that we offer the client some self-care things that they can do for themselves. So Victor uses tennis balls at home. He'll use hot compresses on his neck when he needs to. And so if we can increase just the flexibility within the muscle tissue, that just helps eases some of the tension around the joints also. Besides the upper trapezius, some of the deep posterior neck muscles I'm working, some of those that run along the spine. So with the kyphosis that is in Victor's upper back, these muscles are elongated in through here. And so they provide a little bit of attention, quite a bit of tension. And so we just try to give it some love. Right, Victor?
Yes.
Yeah. So massage can affect really many different systems, not just the muscular system, the fascial system, circulation, blood vasculature. It just helps keep things moving, a little bit more pliable, less stickiness in the body, allows the muscles to move independently of each other instead of all stuck together. Trigger point therapy is somewhat considered deep tissue therapy, and that's basically a therapy that you want to identify pain patterns that people have. And when people have pain patterns, you target specific muscles that might create those pain referrals. The benefits of, you know, getting monthly massage is also helping maintain things so that when you do get injured, that maybe you'll heal a little bit quicker, a little bit easier, and understand why maybe that mechanism occurred and why you did get injured, and then what you need to do to prevent that. Recently, I was able to work with somebody that was in an auto accident, and she had had previous injuries, and the benefit of massage really helped educate her in what was going on in her body. And so she suffered from whiplash injury, meaning in the neck. She whipped her head back during the injury, and she had a seatbelt on, so she had some chest tightness, and also her breathing was a little bit shallow. So we worked with her. She had developed some headaches, and we worked with her on a weekly basis, and she now doesn't have much pain, which is great, and she knows how to support herself a little bit better, and she's on more of a monthly maintenance now. One of the important things I feel in building relationships with your client is really trying to understand who they are and what their trials and tribulations are, and what physical demands they have, either weekly, daily, monthly, whatever that might be. The more that you can understand maybe what their physical or emotional levels are, the more that you might be able to pinpoint it in their body. Yeah, Victor, how do you feel now?
I feel wonderful. I can, no, scale of 1 to 10, it's probably a 1 or 2.
Yay, Victor.
I have post-mastectomy lymphedema, which is lymphedema that was created by having 21 lymph nodes removed when I had a mastectomy. Within a year of having the mastectomy, I noticed the swelling, but it was a couple years before it got so bad that I decided, okay, this isn't going to go away, I better do something about it.
Mm-hmm. And then you came here.
Started coming here, yeah.
Who referred you to here?
My wonderful primary care nurse practitioner, Karen Del Vecchio.
Okay, okay. So on a scale of 1 to 10, it's when you first came, what was your pain level and discomfort level?
Oh, it was really quite constantly annoying, probably between 4 and 7 on any given day.
Okay, and what is it now, years later?
Very manageable, 0 to 2.
Wow, that's a real achievement then,
Yes.
to have got that down. That is good. So after a treatment, say if you come into a treatment and your pain level's quite high, how is it after a treatment and how long does it stay low and how long does it take to sort of get back up again?
Well, it's been a while since I've been having a lot of pain issues, but thinking back to when it was fairly constant, the treatment was so profoundly effective. I would say it was often down to 0 or 1, even on a bad pain day, and that sometimes it would take, a day or 2 before it would start coming back.
Oh, that's good. So how much of your recovery would you attribute to the treatment you're having here?
100%.
Really? That's
Yeah.
very good.
Well, I wouldn't have learned how to take care of myself. I wouldn't have learned how to wrap my arm at night or be diligent with a compression sleeve if I hadn't come here in the first place.
My Ayurvedic teacher said to me, he said, Rohini, the journey to enlightenment is 30 centimeters. It's the distance between the head and the heart. This 30 centimeters to well-being, this distance between the head and the heart, was what we wanted to promote as a basis, a foundational aspect of integrative medicine. The head and the heart. What is that all about? We have in traditional medicine a huge respect for brain processes, cognitive and analytical thinking, and the decision making based on that. So what the heart has to offer is coming down into the body, a somatic sensation of knowing ourselves, our sense of our own emotion, our sense of our own relationship of love, and that in order to make really good decisions for ourselves, health-wise or in any other way, but here we're talking about health, of course, is that our best decisions about health and our sense of well-being comes not only from the analytical part of ourselves, but also from our heart, our consciousness, our kindness, our sense of our own emotion.
I was teaching 13 classes of dance and fitness a week, and my supervisor in the senior center had a migraine headache, and she mentioned to her secretary that she was going to go home unless she felt better. And I asked her if I could work on her feet. And she said, I don't have any foot pain, I have a headache. And indeed, I was able to spend about 40-50 minutes working on her feet. And when I came back to see her an hour later, she was feeling much better and said, I have not had this response with 3 years of medications. Will you do this for my senior population? And I became certified through the International Institute of Reflexology and started my private practice in 1988. Let me tell you a little bit about reflexology. Reflexology is a form of bodywork which uses a deep compression technique on the feet, legs, hands, and ears. The appropriate pressure is stimulating to the peripheral nerves in the feet and hands. Those nerves respond to every part of the body. Every gland, every organ has a reflex area or a nerve pathway. By stimulating through this deep compression technique, I can access every part of the body through the feet. The feet end up being mirror images of the body system. The problem with connective tissue is that it takes a long time to heal because it gets very little circulation. Reflexology helps pull the circulation into the foot, allowing the tissue to heal. Primarily from improving circulation, both vascularly and circulatorily, to the legs and feet. By working on muscles, tendons, ligaments, bones, I can change the pedal foundation of how we walk upon the earth. Circulation gets improved to those areas of the feet, and in response helps general circulation to the whole body. It also increases the range of motion. It also helps with stability and balance issues. So most people that have foot pathologies will feel relief. Some of the foot pathologies that I have worked with are plantar fasciitis, neuromas, neuropathies, heel spur syndrome. My favorite thing is to induce babies. In a 90-minute session, I will work the feet, the hands, the ears, overstimulating the neurological system in the body to get the uterus to start contracting. And I love my baby wall.
The Chinese noticed thousands of years ago that we are energetic beings. And the energy in our body, the qi, not only flows through us, it flows through everything. It's life force. It's everything that is. And they notice that the qi flows through the body in certain channels. And it flows deep within the body, and the channels also flow more to the surface. And they found out that when the energy, the qi, comes to the surface, there are certain places where we can insert a needle and increase that flow of qi throughout the whole channel. The idea being that when all the channels are free flowing, the qi is flowing, the energy is flowing in the body, health is achieved. So that is basically what we do here. We're accessing the flow of qi in the body. And for me, being a Westerner, I still am amazed. Every time someone comes in and they have this problem or that problem, they have a treatment and they walk out saying, I feel so much better. Then I know I'm amazed, because all I've done is insert some needles into their skin. So it's just a wonderful, wonderful, kind of mysterious practice that we do.
How to keep this physical body at its optimum best, and even in advanced age, how do I live a very healthy life in my physical body? Science of Yoga teaches this. So this will involve right diet, right exercises, right environment, right leisure, and a balanced lifestyle. So this is the first teaching about the physical body. Then Science of Yoga will move on to the mind and give us a teaching how to keep the mind free of all stress, tension, how to find peace, contentment, satisfaction, well-being, and a general cheerfulness within, how the mind can be always in this state. That is one of the teachings of Science of Yoga. Then we move on further Our human nature has anger, jealousy, greed, fear, some of these negative emotions. How do we transform these negative emotions, handle them, deal with them, and transform them into spiritual or higher positive emotion? That is one part of the teaching of the science of yoga. Then we further move on to our intellect. How do I expand my intellect so that the intellect is not bogged down in certain belief systems? Much of the pain and suffering in life comes because of belief systems which we think is true and it is not true. So how to free my intellect from all belief systems and experience a higher expansiveness and truth? That is what yoga teaches. Ultimately, yoga will teach how my soul, at this moment I am not at all aware of my soul nature, my divine nature. How do I become aware of my divine nature? Yoga will teach all this. It starts with the body, moves on to the emotions, moves on to the intellect, moves on to the spirit. Today we know that any ailment in the body, including ailment that is coming from a virus or a bacteria, any ailment in the body is not just it is a psychophysical ailment. So something in the mind, there is a cause in the mind for any physical ailment. This is well established now. So in holistic healing, we will have to find out what exactly are these causes in the mind. It can be fear, it can be tension, it can be anxiety, it can be many other emotions in the mind which is creating a tendency for the body to fall sick. So yoga brings about a beautiful healing of the mind of its negative emotions. Moment the negative emotions are healed or reduced, the body automatically becomes healed. Doctors are healing it from down below, and holistic healing comes from top, and both merge and the benefit will be the best.
The Taste of Therapy is the opportunity for the public to come and experience different practitioners and modalities. It is also an opportunity for practitioners to come and show what they do to the public for a small taste and a small fee. We have everything from massage, which is very popular, reflexology, acupuncture, Reiki, healing touch. We also have chiropractic and readers, and the fee is only $5 for 15 minutes. I believe that the city supports it because it's a great community event and it's a community service that we feel we're providing, an opportunity for people to experience wellness. I have witnessed a few times people getting off of Dr. Sid Wolf's table and tears were flowing, never been able to walk like that before, and just experiencing joy for having something happen to them. And I've also just witnessed people just seem to float right out the door after they're so relaxed after experiencing so much wellness.
If someone came to me for the first time, either at the booth or at my office or whatever, it would be an explanation to, it's important for them to understand that their immune system has to do with all of this, okay? And the immune system plays a huge role in their health, obviously. But it is not obvious that what they are, their emotions and maybe their diet, maybe, it's not just diet, it's how they're thinking, how they're feeling about their life, their lifestyle, their happiness, this is holistic. So holistic means, body, mind, spirit, it's everything. So it's explaining to people that it's not just a pill that you take that's going to, change everything, in their life. They have to see and feel and know what's going on every day in their daily lives and how they are accepting life and how they are dealing with stress. We can't get rid of just stress. Everyone talks about stress. We all have stress. but the important is how you are responding to it.
It's incredible because, again, the treatments are very short and concise, but sometimes people will get off the table, they'll have some shoulder issues, and their shoulder is already better within just 15 minutes. Usually my treatments are a little longer, but you can see some effectiveness in just a short amount of time. I would say keep an open mind. There's a lot of different practitioners here. Some are going to work for you and some aren't. And have a really good time. Surely for the people who've come here and have gotten tastes of different types of modalities and have opened their eyes to how much it all works, you can see the change.
My name is Maura Ewell, and I teach and practice Reiki. Reiki is an ancient modality, actually, and what I think Reiki is that what I'm doing is I'm bringing God's energy in through my hands. So the palms of my hands get warm. Your body recognizes this perfect vibration of what I think is God's love. And so that's how the healing takes place. The healing can take place on spiritual levels, physical levels, emotional levels, mental levels. And I've been doing Reiki for about 11 years. I expect to have a lot of great people come through. People are curious and they're open, and it's really a cool thing to see how people accept this modality, especially if they haven't experienced it before. One of the experiences that most recently that I've had with Reiki and doing wonderful things is a woman who had a double mastectomy. And she was feeling totally out of her body. She was crying all the time. She couldn't really, she couldn't grasp what was going on. Her whole life had changed. And so with about 2 hours of Reiki, by the end of it, she completely changed. Her coloring changed, her attitude changed. She said she felt safe again, and that was a beautiful thing. Doctors, I think, are recognizing more and more that it's not just a mechanical being, this body, you know, we are all of this being, and that includes mental, emotional, physical, and spiritual, and so we have to work with all of those together. And if you're coming to this fair today, I hope that you are open and try to leave all of your old conceptions and maybe stigmas at home, and just come and experience it. Feel it. Don't think so much, just feel.
One of the things I particularly like about coming to the Taste of Therapy is I get an opportunity to sample what the different practitioners offer. So I can see if a massage therapist has a type of massage that I really appreciate, that I can then call when I would be interested in a more extensive massage.
I've been coming here for probably 4 years. I actually found a number of practitioners here that I continue to see year over year. So they've become a long-term care for me. The one that I did first it's called Body Stress Release. And so I started that probably 4 years ago. And I still do that on a regular basis. And then the reflexology, that was probably only a year ago that I started doing that, but now I do it several times a year. So I've been enjoying all that. And massage, I always do massage. Well, I mean, I've tried things that I haven't tried before here. And so I guess in that way you could say I was skeptical. And yes, I've tried things and I've come back and I've done them more. So yes, it does kind of open your awareness to the different modalities, the different kinds of things you can have done, and yes, you're much more likely to try them.
I think you have more people interested in all these different modalities now, whereas before there were a limited amount of people that came, but now you have to come early before the doors open in order to get what you want.
There really was a different attitude of patients towards medicine. Medicine was far more patriarchal in the past, and there was an expectation, you're the doctor, you know everything, please fix me. More and more now, thanks to the age of extraordinary amounts of information, some of it very bad through the internet, but the age of information, people are increasingly empowered and wanting physicians to practice patient-centered medicine. They want to be heard about who they are and what their story is and what they need from the physician rather than the other way around.
The way integrative medicine, I think, will interact very beautifully with healthcare reform is we need the high-tech medicines that our country offers. We hear about Da Vinci. We hear about all the beautiful new ways that we can offer technology, including barcode medication administration so that we make sure people get the right medicines. And we've gotten so good with our technology that we've almost forgotten the humanistic side. And so we can't have high tech without high touch. And I think healthcare reform is truly the integration of high tech and high touch. Why? High touch is affordable. It's okay to sit and listen to someone. It's okay. We now are looking at our hospital as part of our mission is getting our patient's story, writing it down, putting it on the chart, because they're not just there with pneumonia. So looking at integrative medicine doesn't just mean giving a massage, putting an acupuncture needle in someone. It means engaging them in so many different ways so they can be well.
I invite you to come on home to sweet old you, to stay and learn about you, and to enjoy the magical transformation towards a greater sense of health and well-being.
My name is Rebecca Stevens. I am a practitioner. I'm a Watsu practitioner at the Health Center of Integrated Therapy. Water shiatsu. Part of the advantage to this work is the warm water and the rhythm of the movement tends to encourage relaxation on a deeper level than if we were doing a table massage. And now we're opening it up to the outside. All of this is going to free up the hips, and we all have hip issues and low back issues. This is wonderful, especially if there's ever been any trauma to this area, without the pressure of actually someone directly pushing, as in table massage. I have had so many people say they can get to a much deeper level of relaxation, particularly in areas that have been injured or surgically reconstructed. In the water, you've got a three-dimensional medium where you have no pressure. And so often, you can't really massage deep into the joints. You've got these really strong ligaments that are holding the joints together in place. But with this, because there's actually no pressure, there's nothing for the body to resist. So it just opens right up. The shoulders, the hips, the back,